Yes, friends, this is a call from some people that wanted to me to talk about something, and several people have requested, so it's not good not to talk about it. The thyroid. The thyroid function. I had say I'll come at 10. Yes, I'm here. So if I think I'll just run so that if the persons that requested are here, they can they can listen to it later also. So several people had requested we talk about the thyroid and its functions. So is uh, the thyroid is a gland. You know, thyroid is a thyroid gland. The thyroid is a gland, and a minute I see where is this. The thyroid is a gland. So when we talk about the thyroid, what do we mean? The thyroid is a small butterfly-shaped endocrine gland located in the front of the neck. Despite its size, it plays a very major role in a person's life. Everyone, when you talk about the thyroid, you talk about something that is on your neck here. The thyroid is here on the neck. I've said I've come here because now it's not the normal time, but Elmarie Smith, hi, welcome. Welcome, Elmarie Smith. Welcome to the platform. I got a request, several requests coming in. I talk about the thyroid. So it's gonna be short. We are not going to take it so long. I'm gonna talk about the thyroid. So we get to know that what is the thyroid and what does it do to the life of a person. You know, sometimes um, the thyroid gland can have so many uses. It can have so many uses, and one simple mistake can make you have a problem when it comes to the thyroid. So, what is the thyroid? The thyroid is a small butterfly endocrine gland that is located here at your neck. Despite its size, you know, it has got a lot of work that it does. It has got a lot of work that it does. The thyroid produces key two hormones that are very important. One is T4. The other one, it is called thyroxine 4. I usually like pasting this word so that people can follow up as they watch on the chat disconnected. Let me paste this. Okay, that one. So that as people go through the charts later, they can read about whatever that I've written. So we will talk about the two key hormones, one being the thyroxine T4, thyroxine 4, and thyroxine T3. So when you hear about the thyroxine and thyroidine or thyroidine, thyronine, let me paste it. You can read about it. These are the key elements that the thyroid produces in your system. The hormones regulate metabolic and effects almost in every organ. You get it? The two key hormones but remember we have another thyroid gland called the parathyroid. Parathyroid, that one controls calcium in your body. But in metabolism and any other thing, we talk about the two key, thyroxine, which is T4, and the other one. Those are the hormones that those are the two hormones that the thyroid produces. Triiodothyronine. Triiodothyronine is T3, which is the active form, but inactive form is T4. Let's see how this just a minute. how these hormones help you in your body. We have said the thyroid is a gland in your body. It helps regulate your body's metabolism and overall function. Metabolism and overall function. Humble Marcia lifestyle. Humble Marcia, welcome. I've come because some people have asked me to talk about thyroid issues, and I think it is. It's at work. It's night here, and I have some time. So let me talk to these people and everyone that will appreciate the talk about the thyroid. Now, triiodothyronine is three atoms more active and powerful in your body. So T3, if you have ever done something called T3 in the thyroid, it is three atoms and it is more active than T4. Acts quickly in the body. And then T4, the one that we've called thyroxine, T4, it contains four atoms, less active. It is less active but produced in large an amount. The gland, the thyroid, produces thyroxine in large amounts in your body, large amounts, but it's not so active. The active one is T3, less active but it is produced in large amounts, acts as a storage form and it is converted into T3 in tissues. So as I don't know if you are understanding, the thyroid produces, as you watch, please like the topic so that we can get more impressions. You know, more impressions call so many people. The thyroid is a gland and it produces hormones that help you in metabolism. Metabolism means some functions, like which functions? It helps in controls of your body energy, heart function, temperature, growth and development. We will see about that. Nervous system, like alert, moods, reflex. When you are sad, you are happy, this thyroid helps you. Digestive system, we'll see the 7 functions of the thyroid. But before we see that, Bubbly Beth, hi, your thyroid, great subject. Maybe I come learn when I'm underactive. I have an underactive one. Okay, Bubbly Beth, I have been requested. I talk. You know, this is the week of. Oh, okay. I got one of my thyroid removed. We are talking as I introduce this Ambomasia lifestyle. I will talk about, before I leave, how to live without the thyroid, but you are living a humble, happy life. So let's watch and let's continue. Let's continue. We see now we have said the thyroid. There are two types of thyroid: the thyroid itself and the parathyroid, which is behind. We are talking about the thyroid, which produces thyroid. We have said T4, and T4 is called thyroxine, which is not active. It produces it in the body, but it is not active. The one which is active is called T3, which is converted from T4. So T4 always just works in your body. The thyroid produces it, it works in your body, but it's not active and functionable. You get it? The T3, when it is broken down, we will see how it is broken down. We will see how it is broken down and how it works. You see? So thanks a lot. My sister is here, Margaret in Norway. Welcome, my sister. I missed you so much today. I hope you are okay. As we continue, like the video and we contain ourselves, we continue. Thanks, Margaret in Norway. Margaret in Norway, please post your link here of your YouTube channel. Please post your YouTube channel here. Yes. Now, we continue how these hormones are produced, because we want to learn how they are produced and how do they bring problems. How? You get it? Life with Russell's. Welcome, Life with Russell's. You see, Life with Russell's, I've honored my promise to talk about the thyroid at this time. I've not gone home. I'm still at work, but I've said I have to honor my promise. Now, the brain releases thyroid stimulating hormone. You get it? Let's go slowly, my friend. The brain releases thyroid stimulating hormone from a gland called in the brain pituitary gland. So when you see, it is a very direct thyroid stimulating hormone. So this brain, that hormone also only stimulates the thyroid, comes from the brain. So it goes to blood and then it reaches to the thyroid. It is called thyroid stimulating hormone, and it stimulates the thyroid from the pituitary gland. So this hormone, thyroid stimulating hormone, comes from the brain at a place called pituitary gland. THS, as it comes from pituitary gland, the thyroid, the TSH, it goes to your bloodstream, then it reaches your thyroid, stimulates it. And then what happens? The thyroid, it produces T4, which is at high level, and T3 at very minimal level. You get it? That is how it is. It works. In tissue like liver, kidneys, and other tissues, T4, when you see when it is going through your bloodstream, the T4, when it reaches the liver, it is converted to T3. So now it is active. It is active. It is active right now. I like explaining and having them like. So if you are here and you are liking, let me draw a person with legs, a person with legs, a person. I want to explain something. This was the hand. This is the hand. Now, this is it. This is my person. This is my person. This is my person. I want to explain something about the thyroid. Yes, boss one is here. Thanks a lot, boss one. I've honored the promise of talking about the thyroid. Someone really asked it on the other time so that we learn. So this is my person. Now, in the brain, there is pituitary gland. It produces thyroid stimulating hormone, TSH, which stimulates the thyroid that is here. But when it stimulates this, it produces T4 and T3. T4 and T3. So they go through the bloodstream, and then they reach the liver, the normal glands, the liver, the kidneys, and they produce, when it reaches any gland, it changes to T3, which is the active form now. That is the one that makes you feel the effects of the thyroid. You see, we have started from the brain producing thyroid stimulating hormone. It has stimulated the thyroid, and it has gone producing T3 and T4, and then it has gone to glands, where now in the glands it is making T3. Yes. By there we are okay. Very nice. That is a normal. Now we are going normally. How these things are produced. And then we see now T3 and T4. They control the body metabolic rate and affect almost every system. How do it? Margaret, yes, at least I'll give Margaret a jacket. Margaret, I want you to have a jacket so that you can be posting these things. Margaret is a good girl. Get a jacket. Please continue posting that one. Now, metabolism. How does it happen? Increase metabolic rate. So when T3 enters your liver, when T3 enters your kidneys, when T3 enters your glands in your body, it increases in oxygen consumption promotes heat production. That is called metabolism. Metabolism is breaking down of energy and producing more heat. You get it? Producing more heat so that you can feel warm and you can have energy in your body. Energy. You get it? Hmm? That is it. But when it reaches the heart, from the thyroid stimulating hormone, this one's from the gland has been come to the gland and then it has gone, now it is in the heart. What happens? T3, which is the thyroid hormone that is active, it is called thyroidothyronine. T3, if you have ever had people that have done this, they know T3. It increases your heart rate. Your heart starts beating fast, fast, fast. But when you are calm, most of the T3 goes back to be T4. You get it? So that you go calm. What about growth and development? When the brain has stimulated the thyroid by thyroid stimulating hormone, and then T4 is produced, what happens in growth and development? It is essential for growth and development of children's brain. Children, because when it is stimulating more energy by metabolism, the brain is growing faster. Get me, my people? The brain is going faster. But there is something funny in your stomach. Now, those people that eat a lot and eat slow a lot, and some few of hours, after seconds, after minutes, you start feeling like eating. You get it? What happens to you is because you are releasing a lot of T4 and it is breaking down to the 3, which is an active form. So what happens in your stomach? Food moves faster in your stomach, being absorbed, moves faster. So when you are thinking about food, when you are hungry, you are producing more T3 that is coming from. When you are hungry, the brain releases a lot of thyroid stimulating hormone, which stimulates the thyroid to do what? To promote motility in your stomach. So you start feeling hungry. And the nervous system maintains alertness and mental function. In your nervous system, like the nerves and what? T3 maintains alertness and mental function. So the difference between the active hormones that are produced by the T3 and T4, what is the difference? T3 is highly active. Before we continue with thyroid function disorder, just note T3 is highly active, T4 is less active. T3 is less in blood, but T4 is more in blood because it should be ready always when you are feeling hungry, when you want to grow, it should be ready. Yes, cardiovascular, when adrenaline is released and you are scared, you want to run away. T4 must be more so that it can be converted to T3 so that you can get energy to run and break down metabolism. You say, you get it? When you are feeling cold, when you are feeling cold, when you are very cold, please don't just watch people that are coming in like. T4 must be more so that it can be converted to T3, metabolism to increase so that you can feel warm. You see the functions of the thyroid? But there is another one, the hormone, which is called the thyroid stimulating hormone, which comes from the brain. You see how they connect? It starts from thinking you are hungry. It starts from feeling you are frightened. Then thyroid stimulating hormone is released. Then it goes to stimulate the thyroid. After it stimulates the thyroid, T4 is created. And according to what you are in, are you scared? Do you need your heart to beat faster to get energy, blood, to get oxygen to the muscles? It converts T4 to T3. So T3 is the active form. You get it? Very nice and very That is how the thyroid gland works. You get it? Do you have mood disturbances? Are you hungry? Are you angry? There is hungry and angry. Has someone made you angry and you're feeling? No, just know when you are angry, don't want to talk to someone, more T3 is being generated from T4. That enzyme in your brain is producing more T3. You get it? Now, that is how the thyroid functions. But let's differentiate between T3 and T4. What is the difference between these two? So we have said T4 is more in blood, but T3 is less in blood. T3 acts faster, but slow is T4. And then we have T4 mostly produces T3 because mostly T3 is produced from T4. Now, let's continue on disorders of T3 and T4. What are disorders? Today we have, if anyone has a question, it's just a short session, but this session will come again in full swing because it's a very wide, I was requested to go through it faster and faster. Now, there are some function. Oh, Messi, welcome to the chat. Hello, birthday boy. It was yesterday. I'm older now. But thank you for giving me the tag birthday boy. Now, we have some functions, I have to say. The heart rate, body temperature. When you have high T3, you'll increase your heart rate. When your body temperature is feeling so hot, when your body temperature is feeling so hot, what happens is you will have high thyroid levels, T3. But when you are feeling cold, Tulips Corner, welcome to the platform. As you come, please give me likes. I get some impressions. Yes, I will appreciate. When you are feeling so cold, your T4 is your T3 is high. You get it? In growth and development, it helps in children's brain development when T3 is high. You get it? Yeah? Supports normal growth and maturity. The nervous system. How does it affect the nervous system? It affects mood, alertness, and reflexes. Imbalance can cause anxiety and depression. So when the balance is, you have less T4 and less T3, you will have mood that is down. You get it? The imbalance. Maybe you have a lot of T4 and minimal T3. The imbalance brings, you check it out. I'll talk about it in complications. Digestive system. Controls gut movement. So if you have a lot of T3, you will diarrhea. When you are having a diarrhea and you have thyroid complications, just know your T3 levels are high. And when it is too low, the T3, the thyroid hormone, you will have constipation. So if you are coming in right now, please, you will rewatch to know about T3 and T4. You get it? My T4 is high. Yes, that is, we were going, humble Marcia, we are going to learn about hypothyroidism and hyperthyroidism. So you just be patient a little bit. And also for women, it influences hypothyroidism. So let me go first on the problems, then I discuss about hypothyroidism and hyperthyroidism. Then we can close the day. We do cirrhosis. Some people had asked we do cirrhosis, but that one we can do tomorrow. This is just a quick. So the problems of hypothyroidism and active thyroid, low thyroid hormone production. You will have fatigue, you will have weight gain, You will have cold intolerance because you are not producing heat. You will have constipation. When I'm talking to that, I'm saying the active one, the T3, the active one. You will have slow heart rate. You don't have energy because you see, you will have slow. Okay, which word is confusing? Hypothyroidism means low thyroid hormone. Yeah, you have low thyroid hormone. You have low T3 and T4, and we have said T3 comes from T4. So if T4 is low, directly you have low T3. You get it? So if they are low, what can you have? Your body will always be tired. You will have weight gain because there is metabolism is low. I mean, or I mean, weight gain comes from this perspective. T3 makes you break some energy by burning some fats and burning some glucose. But now the T3 is low. What is happening? Yes, Agnes Thomas, welcome to the platform. What is happening? What is happening is this. It is the T4 that you have is low. There is low T3 to break down the cholesterols that you have in your body and the glucose. So the liver will continue producing more glucose and glycogen. And when the glycogen in the liver is more, you will start producing more cholesterols and fats. Because of low, there is no T3 that is activating the metabolism pathway to break down the fats. So you become big with more fats. You see how fats come? Cold intolerance. If metabolism is low and you are not burning some carbohydrates, you are not burning some fats, you are not burning, you will not produce heat. The liver should burn some fats. When T4 gets there, it is converted to T3, which is active. It starts burning some cholesterol. Then you produce heat. The liver is the one which produces heat. And then you will be depressed because there is no T3 that will excite you. Common causes are Hashimoto and iodine deficiency. You know, iodine helps in producing some effects in the T3 and T4. Thyroid hormones are produced from iodine, and iodine is the normal salt. So if you are not having normal salt intake, Dr. Benjamin, happy belated birthday. I'm still receiving her birthday messages. Very nice. People love me and I love you too. Thank you so much for those warm messages. Thank you so much. So when iodine is low, what happens? You don't have enough hormones and those problems are there. Now, let's go to high, hyper, high overactive thyroid. When the thyroid stimulating hormone from the brain is released and then it reaches to the thyroid, it produces a lot of T3 and T4. You know, the thyroid can be overactive, and you, where you are still taking sodium chloride, you are still taking salt, feeding it, producing more. Oh, nice, nice, nice. I'll be watching you, Agnes, for your birthday. Nice. Thanks a lot for telling me that. The opposite is the truth. Low heart rate, depression, weight gain. Now you'll be dealing with weight loss because you are having high T3, breaking down every muscle, breaking down every cholesterol in your body, breaking down. Making your heart beat faster. Because you have high T4 is high. Someone told me here she has let me check. She has high T4. Was it Hamomasia? Someone told me she has high T4. Now, this is the situation. You will have weight loss, because T3 is increasing metabolism and breaking down every bit. Yes, ambomasia. Your heartbeat will be high. Sometimes you feel palpitations. You are always worried and anxious, sweating because of the problem of T3 that is breaking, and making work go faster, faster. Heat intolerance. You are always feeling hot and tremors because of what is happening in your body. These are conditions that are called like Graves' disease. You get it? Like Graves' disease. And then if you have a lot of thyroid hormone, it will swell here. It will swell. This is where we find something called enlargement of the thyroid gland. Yeah? Hmm? Iodine deficiency brings enlargement of the thyroid gland and hormonal imbalance. It is swelling in the here. And then you can have thyroid nodules and thyroid cancer or thyroiditis, inflammation of the thyroid. Today it is inflamed, tomorrow it is not inflamed. So, what is hypothyroidism? Hmm? What is hypothyroidism? How do we say hypothyroidism? How do we say someone has hypothyroidism? If you have a question, please ask, because this one, oh, you am on NP thyroid. Okay, okay, that one helps to reduce the production. It stops a process of conversion of T4 to T3. Now let's go on and explain hypothyroidism. Hypothyroidism, when you hear about hypo, it means low. It means low. So hypothyroidism is low, is a condition where thyroid glands produces too little hormones, T3 and T4, leading to slow body. And you see, I want everyone to understand so slowly. The thyroid hormone is stimulated by a gland from the brain, the pituitary gland, which produces thyroid stimulating hormone. Then it goes to blood and stimulates the thyroid to produce two hormones, T3 and T4. But you see, that thyroid stimulating hormone can be stimulating the thyroid, but the thyroid is producing less hormones. It is producing less T3 and T4. Hmm? You get it? So, physiologically, and physically, behind hypothyroidism, what we can understand, the pituitary gland producing it stimulates T3 and T4. In hypothyroidism, what happens is T3 and T4, they are so low, but the thyroid stimulating hormone in your brain is high. Hmm? Because the body is trying to stimulate the thyroid, but it's not responding. You get it? That is what we call thyroid stimulating hormone. So when we take your blood and we go to the laboratory and we run the tests, Sandra, hi, welcome. When we run thyroid function test, we find that the hormone that is in your brain, Sandra, hi, welcome to the platform, welcome. It was a call that I talk about the thyroid, and I'm really simply trying to talk about it. When thyroid comes from your brain, stimulates it goes to the bloodstream, it comes to stimulate the thyroid, it is not utilized, so it remains at high levels. The thyroid only is stimulating and removing low T3 and T4. So when we go to the laboratory and do the thyroid function test, we find thyroid stimulating hormone is high, but the T3 and T4, they are low. There are some causes whereby you can have this problem. You can have this problem in some cases like Hashimoto thyroiditis. Thyroiditis is infected thyroid. Hmm? But you will find mostly the immune system of your body, it attacks itself. So some cells of your body are attacking the thyroid. Just like arthritis, where your body is attacking itself, even in Hashimoto thyroiditis, you find that an infection you have has caused some attacks, and the body you have, your body is attacking the thyroid. Hmm? And sometimes you don't take enough salt. You don't take enough salt. So when the thyroid stimulating hormone, Dude's Page TV, welcome, welcome, thanks. Like the video as we go on. So when you produce thyroid stimulating hormone, it goes to the thyroid. It wants to produce T3 and T4, but there is no iodine in your body. There is no salt, the common salt. So it doesn't have the precursor to produce the. So what happens? It doesn't. It stops, and the thyroid stimulating hormone remains high. So the small little salt that you have in your body creates the little T4 and T3, the hormones of the thyroid. That is another problem. Deficiency of salt intake. Hmm? Salt is needed to create two hormones that are important, T3 and T4, the hormones of the thyroid. Some people don't have the thyroid because maybe it was cancerous and it was removed. So they have to live with levothyroxine, which is a drug. And there is another case here. You are using drugs like amiodarone, amiodarone and lithium. When you are using them as drugs, what they will do, you know what they will do? They will suppress the thyroid. They will suppress the thyroid and the salt you have not to produce T3 and T4. And then there are some people who are born with the problem of congenital small thyroid. Today, I'm talking about the thyroid. I'm not talking about the parathyroid, which controls calcium. I will talk about the parathyroid when time comes. So, another thing is you can have the brain producing low thyroid stimulating hormone. That is another cause. The brain producing low thyroid stimulating hormone. So there is very low thyroid stimulating hormone to stimulate them. That is when we call, and we have talked about how you feel when you have them fatigue. You have seen weight gain. We have talked about if you are coming in, please you rewatch and you check it out. Now, what about the opposite, which is the hyperthyroid? What about hyperthyroid? Hyperthyroid is when these hormones are high. The T3 and T4 are high, causing the body metabolism to speed up, to burn everything. You are using every glucose you have in your body because T3 is high. It is exciting every organ. Pituitary gland releases thyroid stimulating hormone. Then thyroid stimulating hormone from the brain produces T3 and T4. But in hyperthyroid, I'm still repeating so that people can understand. T3 is very high and T4 is high. But the thyroid stimulating hormone becomes low due to negative feedback. You know, when you have high T3 and T4, your brain stops. When high T3 and T4 is produced here from the thyroid, the brain stops to produce more thyroid stimulating hormone. So when we take blood to the laboratory and then we find out that The thyroid it has high amount of T3 and T4, and the thyroid stimulating hormone from pituitary gland of your brain is low, we know you have hyperthyroid. Hmm? But you can do the test and then you find that thyroid stimulating hormone is high and these others are high. That one we don't call it hyperthyroid. It is balanced. So we don't call it hyperthyroid. So common causes are like Graves' disease. There is a disease called Graves' disease because when this person gets it, you will die. That's why they call it Graves' disease. It destroys your body muscles and metabolism is high. Hmm? Your antibodies of your body stimulates the thyroid so faster. Sometimes you find some people their eyes are bulging. You get it? Toxic noticular goiter, your goiter becomes big because of the thyroid hormone. You get it? So those are, I think I've tried to explain, but this topic has a time some time coming that we will explain deeper slowly by slowly. So how does the drugs work? How does these drugs work? How does let's talk about the drugs. Drugs for, we start with hyper or hypo. For hypothyroid, how they work. How do these drugs work? Because now you have a problem, the problems I've mentioned. Yeah? Hypothyroid, there is no any other way. You have to take the hormone as a drug. You have to take that hormone as a drug. You have to take levothyroxine daily. And you have to be going to hospital to be checked the levels every time. Like a month, you go to hospital to be checked the twice. Hmm? You get it? It is levothyroxine is a synthetic form of T3, T4. So when it is you have taken it, it is absorbed in your body, it starts to convert into T3 as needed. As it gets to your liver, hi Barbara. Yeah, you remember Barbara, I was asked to talk about the thyroid. That's what I'm doing. So when it gets to your liver and your organs, it is converted to T3 and you live a normal life. You get it? And why do we take levothyroxine as T4? Why? This is why, because you cannot take T3. Once you take T3, it is active form and it is used very fast. It will get to your stomach and it will be used. So you take something that have a long time to stay. We call it half-life. How half-life is how much a drug can be metabolized into half the milligrams you took at a certain time. So when you take T4, it stays so long in your body when it is not removed. So it circulates as it does it, it is converted into T3 as it is helping you. That's why we use a drug called levothyroxine. A drug called levothyroxine. You get it? Very important as we finish. There are other drugs like liothyronine directly provides T3. When you have very low T3 and you are at a crisis, you really need the hormone, we give you the liothyronine. That is the drug we give you. Those are the important drugs when it comes to hypothyroidism. What about hyper? What about hyperthyroidism? What drugs do we use in hyper? I think the people who requested me to talk to this, they are following and they are getting help. And if you have a question about anything about thyroid, just ask. If you are confused about the words that I'm using, I'm trying to explain, just ask me what we can do. So hyperthyroidism is a condition whereby the gland is producing a lot of thyroid. We have talked about it. So the drugs, yeah, the drugs are those ones like treatment like methimazole that stops the process. It can stop the thyroid stimulating hormone from going to the thyroid to do what? To produce more T3 and T4. Or, oh, there's something I forgot. Yeah. Yes, that way. Sorry about that. We can use a drug that stops the thyroid from producing more T4 and T3, or we can use a drug that goes to your brain to stop more thyroid stimulating hormone. So most of the drugs that we use in hyper, it is to stop the process. The way we have discussed, it is to stop the process to go to the next process. Like a drug like methimazole, carbimazole, azoles. What does this, if you have ever used this drug, this is what they do. This is what they do. Inhibit thyroid pyridoxine enzyme. Eh? This enzyme is needed to oxidize iodine, to bring in iodine so that you can get T3 and T4. So it stops the process of conversion of T4 and T3. Methimazole, if you have ever used methimazole, if you have ever used propyl, so uracil, I know these drugs, some of you know them, propyl uracil, same as methimazole, also blocks T3 and T4. That is how it works. So, guys, this has been a very short session, and I'm just coming in to answer a question that I was asked and requested to talk about. And there are some ways levothyroxine got me swollen to point I admitted to hospital for days. I understand not even medication works well in everyone. Yes, not every medication works well with everyone. You see, it's a hormone. So levothyroxine is a lot of T4. When you take a lot of T4, it cannot, it's an artificial one. It cannot at times be converted to T3. It can do some negative feedback, and the T4 can go so high that the THS in your brain can be produced and go so high. So what will happen? You will swell everywhere. You will swell everywhere. I think that was the case, Marcia. You will swell. So before you are given a drug, you are given a test drug for you yourself. You are given a test drug so that they can know which drug they can use. You get it? Now, here, there is something called radioactive iodine therapy. Radioactive iodine therapy, the normal salt that we use in hospital, is taken up by the thyroid cells, and then the same iodine, what you have taken, it destroys the overreacting cells of the thyroid, the ones that are producing more T3 and T4. I don't know if someone has ever taken radioactive iodine. It decreases hormone production permanently, because when it goes and it destroys the cells that are active, the cells are destroyed and it decreases the production. Now you are okay. You get it? Now, the radioactive iodine therapy has some side effect, and you can get skin rash, joint pain, yeah, and also decreasing in hormone production permanently. You get it? Yeah. When you get to, it is so big, you will have something called large goiter, and you see, at times, it doesn't mean that when you have a big thyroid, it is hyperthyroid. It can be hypothyroid. You can have T4 that is not being converted to T3 at high level, and then thyroid stimulating hormone is high, so T3 is not there, which is needed. You start having something that is growing. So you really need that test so that a doctor can know what he can do. Because if you continue having a lot of T4 and then I'm adding new T4, you will swell your body. Your body will be big. So those results, how they balance is how we take them. If you are having something called a lot of thyroid stimulating hormone and less thyroid T4 and T3, we give you T3 so that it can have negative feedback and the T4 can go down. You get it? My left thyroid had a lot little pockets of nodules. Yes, that is called thyroiditis hambomasia. It is called thyroiditis. Surgery is there to remove large goiter, and when it is you have used drugs and they have failed. Or when we take a sample from your thyroid, we take to the laboratory for a pathologist to learn it, and a pathologist says we can be having some cancer cells in the thyroid. So we do surgery. You get it? I just get the time to join you, Dr. Benjamin. Yes, Hilda Taylor. This was your request, Hilda Taylor. And I think you will rewatch because we have started from very far. I have explained this person of ours, I have explained how the thyroid stimulating hormone goes and stimulates the thyroid up to where it goes to the T3 and T4. So it's good you rewatch so that you can understand. This was your request. Thanks you for coming. Please like, share to everyone who has the thyroid problem. Now, these drugs that we use like methimazole and propylthiouracil, the two, methimazole and in hyper, you can get a skin rash, you can get joint pain, you can get liver toxicity because when it gets to the liver converts T4, which is methimazole, to this drug to T3. So the more you take, the more you can get liver toxicity, and then you start having yellow eyes. So when you start having sore throat, fever, stop the drug immediately, go and see your doctor because it can be the thyroid is getting stimulated so much and then it is passing some effects to the throat. You start having a rub. So that is about the thyroid hormone and how it produces. The next time we'll talk about the thyroid, I'll be going in details and I'll talk about even the parathyroid, which is behind the thyroid, which balances your calcium. You get it? I will talk about it. So people have talked. Where you have not understood, please ask any question. It was just a short session, but you see, we have gone up to around 1 hour. Who has any question about this session, please, my guys? Any question from anyone? Any question? I'm waiting for any question before I go out. Any question? Any question? Hilda Taylor requested me to talk about the thyroid, and they have seen so many people are here. So my plea to the people who are undergoing thyroid issues is, because it's something that you have lived with, my plea is you start, as you go on taking levothyroxine, as you go on taking methimazole, which is for hyperthyroid, you should be repeating the hormones that are produced by the thyroid, the T3 and the T4. It is very important you be repeating them so that you know where you are alive. You get it? It is important you be repeating them so that you know you don't have an imbalance. You don't get into a crisis. It is very important. And don't just do T3 and T4. Do something called thyroid stimulating hormone from the brain. When they do T3 and T4, my thyroid grow inward instead of out. So I could not breathe properly. Why? I remove it. Mine was not overactive. Yes, The nodules were making it to grow inside. Yes, the breathing was the problem. That's why. Did you remove it all or it was a partial? Sometimes we do partial thyroidectomy. Partial means you cut a piece and you leave a piece to continue working. Hambumasia, did you remove all of it? Okay. Now, I see no more questions. Anyone with a question I'm asked before I leave? I see we have, or the left one. Yes, the left one because it is next to the, almost next to the trachea. I think that is the one that had nodules, more nodules. So anyone with any question, a very short session. Anyone who has any question, we wrap up the day. I've talked about the thyroid. It was a request from Hilda Taylor. At least Hilda Taylor knows how to. Hilda Taylor now knows how to live well. If it was a request, if she's not here, I know she'll rewatch and she'll ask a question later. Thank you so much for people who have come through for this short session of the thyroid. The right is okay. Oh, nice. The right is okay. Nice, humble mercy. If you have any question concerning your thyroid, you know the number you can text through. You know the, I take Cabimazole for it. Oh, Cabimazole. So Hilda Taylor, which one is the overreacting? T3, T4, or you thyroid stimulating of hormone? If you are taking Cabimazole, it means your T4 or T3 is high. Which one is high? If you are taking Cabimazole, I think one of them. But for my advice, Hilda Taylor, if you are taking Cabimazole, Cabimazole means you are doing good. And thank you, Marcia Thompson, coming in this short session. If Hilda Taylor, you are taking Cabimazole, it means you are doing better. It helps. Cabimazole and methimazole are at the same level. So if you're taking Cabimazole, I may be requesting that you be doing can excuse. What is excuse, Betty? Please elaborate for me. What is excuse? I want to know what excuse. What excuse is? Excuse. What is excuse? Can excuse help thyroid? Excuse. I want to know what excuse is, please. Now, I was advising Hilda Taylor, if you're taking Cabinazole, it means you are not so bad, and you can be checking once a month your thyroid, twice a month. Exercise. Yes, it can help, but you see, this is something. This is something. Yes, Betty. This is something that is excited from the brain and the thyroid if it has a problem. So exercise, not really, but little exercise in thyroid regulation, in a gland regulation, it's very little. Exercise cannot, but at a very little extent. So Margaret in Norway, not Margaret in Norway, Hilda Taylor. Sometimes I find myself calling Margaret in Norway. Yes, Hilda Taylor, you should be doing twice a month T4 and T3, and at least once or 2 months the whole set T4, T3, and thyroid stimulating hormone from the brain, so that you'll be sure you are doing good. Sometimes this thing you live with them, and if you live with them, you really need to take the chance to be always knowing that you are okay. That is what I will advise you about it. Cute Jessie is here. Cute Jessie, welcome. We have been talking about the thyroid. I think you will rewatch if you got time. And I've done it correctly. Imagine I have less than a minute. So, any other question? Any other question? Any other question? Any other question from anyone? Any other question before I log off? I think we are good. So blessings to everyone who has been here. I think I've tried to explain about the thyroid. So if you have someone who has a problem when it comes to the thyroid, share with that person this video. But the thyroid video is coming in details. We will know how the thyroid uses salt to create T3 and T4. We will know how the thyroid stimulating hormone is released, but I've explained a bit, and the balance itself we will know. Please type what you have just said. Please type which one. What do you want me to type, my Hilda? Tell me what you want me to type. I will post it. Or you want me to type. I cannot type the whole the whole talk. That is a very, unless you go through this video slowly by slowly. Tell me what you want me to type. I will type. But the best thing for you is to rewatch slowly by slowly, and you will learn. Uh, and you will learn. I really don't know what you want me to type. Explain to me before I log off. Even my time is out. Which one do you want me to type? Hilda Taylor, tell me. You know I cannot type the whole, so it will take time. I cannot type everything that I've said, I've drawn here. It's hard to type unless you have a specific thing that you want me to type for you. Please tell me before I log off. What do you want me to type? I'm waiting. I'm waiting for you, Hilda Taylor. I'm waiting for you. I'm waiting for you before I type. So if you are watching and you have not you've not subscribed, please subscribe and share, please. We get more. I'm waiting for Hilda Taylor. She has told me to type something. Hilda Taylor, please tell me what you want me to type before I log off. My time is out. My time is out here. I'm waiting for you. I'm waiting for you, Hilda. Hilda, what do you want me to type? Okay. A minute. Let me give Hilda Taylor a minute before I leave. A minute. Hilda Taylor, I'm waiting. What you just say to me about it. Oh, okay. I'm saying let me type for it. It's important. In a month, please do three at least a test for at least twice. You do at least twice thyroid test for T3 and T4. And there is another one. In 2 months, do the whole set once. What is the whole set? The whole set is thyroid stimulating hormone set, which is thyroid stimulating hormone, and then you do T4 and T3. That is it. Please, that is it. It will help you know how you are. So guys, bye. Let's meet tomorrow as we continue with matters concerning the heart and the problems. Today I introduced the problems. So tomorrow we will start with the first one, which is heart failure. We will start by talking about heart failure as we continue and see how it is. So here it is 11 p.m. and 8 at night. I'm still at work and I need to go home. So please, guys, thank you so much for reaching out. Share this information. Let's support everyone who is watching. Let's have friends that are willing to help each other. Wherever you are, Be blessed. Those are in Africa, good night. Those are away, good morning, good day. See you tomorrow. Bye, bye, my friends. See you tomorrow.